I think it's catastrophic. We don't know exactly how bad it is, but the numbers that we're seeing are alarming. The rate of positivity, that is the positivity that we've seen in the limited testing that exists, indicate that these numbers are just through the roof. So we're seeing a very steep spike from all the indications that we can have. But again, it's limited. It's limited by just lack of access to some of the vital information, but also because of misinformation that we're likely to get from the military junta. They're not reliable. I think it's probably any official figures we get from the government. I think we can just assume that the numbers are actually significantly higher than what we're hearing. We don't know quite how high. We're looking at as much information as possible. But again, we know that the cases are spiking, the deaths are spiking, and we know that particularly vulnerable populations are in extreme danger right now. You know, we have thousands of political prisoners, for example, some with underlying conditions that are in horrific conditions. And we have people crowded into rooms, hundreds in some cases, without access to hygiene, without any masks or anything that would protect them, and no treatment whatsoever, with people showing clear signs of infection. So under those conditions, COVID is just going to run rampant. And we have thousands of political prisoners in those prisons, including opposition leaders, political leaders. And we know that their life is in danger.
You know, the public call the doctors as heroes due to our actions in the COVID pandemic last year. But we have become criminals overnight by the military. Doctors and nurses and other healthcare professionals are wanted. There's hundreds of arrest warrants outstanding right now for them. They're being harassed, and they're being arrested as we speak. I mean, it is just absolutely incredible to me, and I think to any sane person, to think that here's a regime facing this extraordinary catastrophe and spending its time harassing and arresting doctors and nurses and other healthcare professionals. I mean, the fact is, you can't fight COVID-19 and be attacking doctors and nurses and healthcare professionals at the same time. Any reasonable person would understand that, but to give you a sense of what we're dealing with here, the junta is spending precious time and energy harassing and arresting these physicians. I think that there's been just too much inaction. The people of Myanmar don't need more statements, and they don't need more declarations. They need action. They need help, and it's not forthcoming. And I think it's important for the international community to look deep within itself, to look at the options that exist right now that are not being exercised and seize them. Because really, we don't have much time. We're almost 6 months into this coup. Hundreds and hundreds of people have been killed. Untold numbers are being tortured. People continue to be arrested. Attacks continue all over the country. And on top of that, we have COVID-19 and this Delta variant. So this is a catastrophe on top of a catastrophe. So many healthcare professionals around the world are exercising great courage in confronting this disease that obviously, particularly with the Delta variant, is so contagious. But in Myanmar, they're not only confronting COVID, they're confronting a military regime that's attacking them. So it is unique. And we know the steps that can be taken to reduce the risk of COVID, but we also know what can be done to try and reduce the risk of attack by the military regime, and that's called pressure. And what we need in Myanmar is not just emergency medical assistance, but we need emergency international engagement, pressuring the military junta to stop its reign of terror on the people of Myanmar.